Hey guys, is Steve there? Hey Steve.
Hello? Can anybody hear me?
Yes.
Okay, I'm having difficulty hearing everyone right now. Just give me one moment, please.
Yes, good.
Who was that? Who's talking? Was that Diego?
Mark.
No, Mary Lady.
No,
Hi.
that wasn't.
Yes, I can hear you guys now. Thank you.
Yeah, we haven't quite started just yet.
Yeah,
We're still waiting for a few committee members, so
Yeah.
we'll be
Okay, so that was Mark Franklin?
Yes.
Yes.
Okay. And are you representing an organization?
No, I am just attending the community board meeting with hopes of addressing a few issues that are happening inside the community now.
Okay. All right. So you're gonna have to wait a while because we have a pretty full agenda. So we'll be calling upon you when we get to new business.
Certainly. I'm here to learn as well.
Okay, great. Okay, so hopefully hopefully you'll learn some stuff tonight.
Yes.
And maybe we'll be able to convince you to attend our meetings on a regular basis.
Sounds good. Yes.
All right, very good. All right.
Thank you.
Steve, I can't hear you.
Yeah, I tell you, oh, see, I'm not saying anything of value that you should work, you should waste your time listening to.
Okay, thank you.
Uh, I'm commenting on the fact that a couple of nurses have just joined us and and I made a characteristically ridiculous remark about it. We're just waiting. We have we have three board members present, three committee members present, and I'm just hoping that one more will show up so we can get the show on the road and have a quorum.
Did you count me into the three?
Yeah, yes, you're one of the three. Well, so technically, I'm not supposed to count you towards a quorum, so that's why I really want one more person here.
Yeah, I like the other name better, Beyond Waste and Beyond. Well, Beyond Waste was the name that DEC gave their
Hello again, everyone. I actually don't live too far from where this meeting is being held. Is it possible for me to just physically show up?
Absolutely, yes.
here.
We have several people in the room right now. We're at 530 West 166th Street between
Okay.
St. Nicholas and Audubon on the sixth floor.
Sixth floor. Perfect. Thank you. And that's Steve, right?
No, I'm Steve, yes.
Thank you so much. See you guys shortly.
Oh, very good.
Okay.
Yeah, should I tell him to bring us some pizza? Okay.
I can bring some juices if you guys like.
No. It's okay. It's okay. We don't accept bribes. Okay.
Steve, John Francis is raising his hand.
Hey everyone, made it on time.
Could you promote Diane?
Thank you. Lucy, I appreciate it.
Hello, this is Diana with Manny de los Santos's office, with the Assembly Member's office.
Oh, fantastic. Are you here just to observe, or do you have any, do you have a report to give us?
No, sir, we were so kindly invited, so we're just observing right now.
Okay, great. That's great. We appreciate that. Okay, so let me start again. I'm welcoming everybody to this meeting of the Community Board 12 Manhattan Health and Environment Committee, joined in the room by Jacob Banis, our note taker, secretary, and on Zoom by two other committee members, O.C. Kaminer, our vice chair, and John Francis. And let me begin, as I usually do, by reading from the Daily News to let people know that this is Cervical Health Awareness Month, National Blood Donor Month, National Birth Defects Prevention Month, National Glaucoma Awareness Month, National Radon Action Month, and National Stalking Awareness Month, Thyroid Awareness Month, and January 12th is National Pharmacist Day. January 18th to 24th is National CRNA Week. For the nurses in the room, they probably know that that's Certified Registered Nurse Anesthesiologist. No, that's not it.
Anesthetist.
Thank you. You should do this. Anesthetist Week. Maternal Health Awareness Day, January 23rd. And World Leprosy Day, oh my gosh, January the 25th. So we've now been joined by our Heidi Guzman, and so we definitely now have a full quorum and we can proceed. So our first speaker is Natalie Rushinoff, a program assistant with an organization called Beyond Plastics, and she's going to talk to us about an important plastic reduction bill currently pending in the state legislature. Natalie, thank you for coming here, taking time out, and briefing us about this important issue.
Thank you so much for having me. Should I unmute or just?
No, you
That's
should.
good.
You no, you shouldn't you unmute?
No.
No? Oh,
Perfect.
okay.
You guys can hear me on Zoom? Perfect. All right, lovely. I'm just gonna share my screen. So thank you everybody for having me tonight. My name is Natalie Rushinoff, work for an organization called Beyond Plastics. And as As was mentioned, I'm here to talk today about a bill that is pending in the state legislature. It's called the Packaging Reduction and Recycling Infrastructure Act. So I'm going to do a brief overview of the plastics crisis, talk a little bit about the New York City waste stream, and then go into the specifics of the bill. Then there'll be time for comments and questions. And I'm here tonight because we're hoping that CB Manhattan 11 would pass a letter.
Well, that would be nice, but we're.
Oh, I'm very sorry, everybody. I'm so sorry.
I mean, maybe 11 will do that too.
I'm so sorry. CB 12 will pass a resolution of support
Okay.
For the bill. So plastics are made from chemicals and fossil fuels. By fossil fuels, I mean coal, oil, and gas. By chemicals, I'd list them, but we'd be here all night. So there's 16,000 different chemicals used in the process of making plastics. Now, plastics are hard to recycle. Part of that is because when you're dealing with 16,000 different components that all respond differently to heat, pressure, time, it's almost impossible to design an effective recycling system. And also because our systems are getting inundated. So nearly half of the plastic produced every year is for single-use packaging. And that leads to an ineffective recycling rate. In the US, our national recycling rate is less than 6%. A lot of people think of the environment when they think of plastic. So I like to share the statistic. 15 million tons of plastics enter our oceans every year. It's about a truck every 6 minutes. And another area where plastics are entering is the human body. So these are two petri dishes showing micro and nanoplastics that have been found in the human body. Scientists have proven that plastics are in our brain, heart, kidney, livers, lungs, both reproductive systems. Basically, name a human organ and plastics have been found there. And we're still trying to understand the full health impact, but so far, the presence of plastics in the body have been linked to increased heart disease deaths, dementia, and preterm births. So we have an environmental factor, we have a public health factor. Now I want to talk a little bit about the New York City waste stream. So New York City spends $500 million a year on waste exports. That's just the trucking of waste. And plastics and packaging make up 40% of the New York City waste stream. So we're spending almost $250 million every year just on moving our waste. And then there are waste transfer stations located throughout the city. So when you have a lot of packaging, a lot of items for single use, that is increased truck traffic, increased emissions in all of our neighborhoods. And the South Bronx, the neighboring neighborhoods to this neighborhood, are where most waste transfer stations are located. So there's a lot of truck traffic going through CB12, not 11's, CB12's neighborhood. This here is a map of the active incinerators in New York State. We have a total of 10, which is more than any other in the country. All 10 incinerators are located in environmental justice communities. And for anyone unfamiliar, environmental justice is a movement rooted in combating the racist and unjust distribution of environmental hazards. So these incinerators pictured, they handle 15% of our waste. That's a lot of waste that's getting burned. And in all of these communities, as well as frontline communities across the US, they face high rates of cancer, asthma, childhood leukemia, low birth weight, and other serious health issues, not to mention the emotional toll that it takes by living near a source of pollution, as well as devalued property and loss of generational wealth.
Isn't there another incinerator in maybe in Newark, another one in Jersey?
There is, yeah. I should get the New Jersey map up here. There are a ton in Jersey too.
No, just across the river.
Just across the river. Yeah.
Most of Manhattan's waste goes
So
to
it's
that
to that.
incinerator.
Yeah, that's, yeah, right, yeah.
Yeah. Thank you. I'm gonna add that to the presentation. So that there's so much to talk about. It's really, we could go on all night. But I'm gonna actually talk about what I'm here today. We have a chance to change and address some of these issues. By passing the New York State Packaging Reduction and Recycling Infrastructure Act, Senate Bill 1464, Representative Harcum is the sponsor of that bill, and then Assembly, the bill number for the Assembly is 1749, and Assemblymember Glick is the sponsor. So this bill would establish an extended producer responsibility program for all packaging, and it would do 4 main things. So the first is it would require companies that any company that makes more than $5 million in sales or produces more than 2 tons of packaging annually to reduce the plastic packaging that they produce by 30% over a 12-year period, reduce all secondary packaging by 50%, and then it would also require that 75% of the remaining packaging, this is like glass, cardboard, aluminum, to be reused and or recycled at a, again, 75% rate by 2052. The second thing it will do is it will save taxpayers money. So companies covered under the law will pay fees to cover the waste management of their packaging. This part will be handled by a new arm of the Inspector General's office. And we ran a 2025 report and found that in the first 10 years, just looking at the reduction in waste exports and trucking, this bill would save the state $1.3 billion, with $818 million going to New York City. The municipalities would be given these savings and would, be allowed, and also would be paid the fees. Would be given the fees, and will have free rein to decide how they want to use that money. There are exemptions to PREA, so we've met with industry and small business, big business numerous times, and we revised this bill 27 different times to try and make it something that's both fair to the environment and people and business. So any company that makes less than $5 million in sales is exempted. The other exemptions are agricultural cooperatives with fewer than 50 employees, companies making infant formula, medical foods, products regulated as drugs, animal biologics, pesticides, packaging used to contain hazardous flammable products, architectural paint containers, as well as containers covered under the bottle bill. Part 3. So PREA would ban the 17 most toxic chemicals from being used in our packaging. The 3 that strike me the most on this list are lead, formaldehyde, and PFAS, also known as forever chemicals. I'm not going to read through all of these, mostly because I can't say all of them, but I will be sending my slides to you all, so you'll have this full list.
But isn't there already a future ban on PFAS?
I think it's pending.
I thought it's going into effect very soon, maybe even this year.
Oh, well, if it's at the state level,
Yeah,
this then it's double banned, which
Okay.
can't be a bad thing, right?
okay.
I'm gonna look into that, thank you. So, and then part 4, PREA, is it would establish a strong definition of recycling. So companies would not be able to count any incineration or chemical recycling of packaging to the rates that are set in this bill. Basically, this is trying to improve transparency, and it means that when you're being told something is being recycled, it's not going from product to fuel, it's going from product to product.
They currently count stuff that's incinerated
Yeah.
as recycling?
They
The
do,
incinerator industry is really vile.
Oh, my God.
yeah. So now affordability is top of mind for everybody in New York City and New York State. It's also top of mind for us. So I want to talk a little bit about what about grocery prices, because this is not a bill that's just about shifting the costs from municipalities to consumers, even though that's taxpayers still are paying for that. So here's a couple of points that I want to bring up. So Consumer Reports and Independent Consumers Bureau ran a study on extended producer responsibility programs for packaging and found that there's no evidence that EPR policies for packaging result in higher prices for consumers. There are 1 billion people in the world currently living in places where EPR for packaging is in place. We just are not currently there in New York yet. And so that's the areas that they studied.
Oh, I want that last point about the number of people in places that already
Yeah,
have it.
I can send you all, I'll send, in Oregon, in the states, it has the best EPR law currently, but we're gonna make New York have the better one. Anyway, so the USDA, according to them, packaging makes up a fraction of the cost of consumer goods, just 2% on average, and PREA is designed to push companies towards reduction. So hopefully there would be, hopefully they'd be just encouraged to remove the plastic from their product. Companies can and do adjust how they absorb costs, often choosing options that avoid price increases, altering packaging design, reducing packaging bulk. And 80% of groceries are controlled by just 4 corporations. So these companies make billions in profits every year, and they have the wherewithal to redesign their packaging. So I also want to have us all consider the externalized costs of packaging. By that, I mean the cost of recycling, waste disposal, and hauling. Also, the environmental justice impacts that reduce property value, lost generational wealth and opportunities, as well as the health impacts. So there was a study done by the Endocrine Society on 2018 health costs, and it estimates that the U.S. spent $250 billion because of the health impacts of plastic. And then in November, Duke came out with a study looking at the social cost of plastics, which is looking at plastic costs from an economic, environmental, and health standpoint. And they said a conservative estimate is that it costs the US $1.1 trillion each year to deal with plastic. So we are paying this price in many other ways and in much bigger ways. Who supports this bill? So 73% of New Yorkers support this bill, according to a Siena poll done in April of 2025. 30+ environmental justice groups, including We Act, which I know is adjacently located in Manhattan 10, but
No, it's,
They include us.
they do? Okay.
in fact, we have somebody from We Act on, attending the meeting tonight.
Oh,
So, no, they're located they're actually located in Board 9, but they concern, they take in basically concerns of all Northern Manhattan.
okay. Gotcha. Apologies for the misrepresentation. And, We Act wrote a great letter of support for us, and so we're very grateful.
We expect no less from them.
And then 300+ civic, environmental justice, health, and community groups, including the NAACP New York State Conference, NYPIRG, League of Women Voters, American Lung Association, American Academy of Pediatrics, 130 faith leaders, New York City Council, both the current and former mayor, New York State Association of Counties, and 27 and counting counties, towns, and community boards.
The current mayor has taken a position on this?
Yes, and he was a co-sponsor when he was.
Oh, of course. Okay, very good.
Yeah. So our ask of Manhattan 12 would be, if this feels in alignment with your community, to pass a resolution of support and send it to your state legislators as well as leadership. As you can see, for Assemblymember Manny de los Santos, he is a co-sponsor, and so is Assemblymember Al Taylor. And then Senator Robert Jackson, who's a co-sponsor, voted yes on the bill when it came up for a vote in the Senate this spring. Fortunately, it didn't make it to the Assembly floor. But this bill is being heavily lobbied on, and we're talking the biggest companies in the world: ExxonMobil, Coca-Cola, Nestle, the list goes on. And we have a report telling that I can send you, saying everyone who lobbied against this bill. And so if you write a letter of support, this gives your state legislators more firepower to, when the lobbyists come to them, they can say, I hear your concerns, but this is what my community is saying. In conclusion, just want to say thank you so much. And I would love to hear any questions, feedback, or comments that folks have, and just very grateful.
Well, we're grateful that you came tonight and gave us this presentation, which I thought was excellent. But let me ask a question, because some years ago, when I tried to get the community board to pass a somewhat similar resolution in support of legislation that would extend the redeemable bottle law to cover all sorts of additional maybe it was juice bottles and other things, not just soda and water.
Yeah.
There was a great deal of opposition to it. In fact, I couldn't get it passed because of the sense that it was going to impose burdens on bodega owners and others. This legislation, would it have any impact at all on local stores?
Oh, like, would local stores have to change or pay fees?
I mean, we're not returning any of the plastic material to
No.
the stores. It would still go through our regular waste stream, still be collected by sanitation.
Yes.
But the whole point here is that there would be less of it.
Yes, the whole point is reduction, and also the companies that we're talking about who would be affected and pay fees are producers of plastic.
Right.
So if a bodega is carrying, Gatorade and Cheez-Its and all that, they hopefully that would have no unless they don't want to carry them anymore, but it would not have any effect on their.
Is it possible to make an argument that if there's less packaging, the store owners might actually have more room for more grocery items?
I love that point. I'm gonna run with that. Yes, yeah, because a lot of packaging redesign is around reducing the bulk. There's so much air, with the Cheez-Its box. Also gonna run with that. There's a lot of air inside the box, and you have the bag of Cheez-Its. To comply with this, they could reduce the size of the box so it matches the bag better, and then the bag could be switched to paper lined with wax.
Or because I mean,
Increase using concentrates, so get rid of all the extra water too.
True.
Yeah. But if you think it's a reasonable argument, I would like to use it because of the questions I've had in the past.
Would love that. That would be great.
I think it can be argued, Steve.
Well, I want to make sure it's a reasonable
I
argument.
think it's a reasonable
I
argument.
don't think it's an unreasonable.
Okay, all right, those are my questions. Jacob?
Just quickly, what was the assembly bill again? I want to make sure. I like
Assembly number-
Well, you're gonna forward this presentation to us.
This whole presentation.
1749.
Thank you.
I wish I'd known that. I was with Assemblymember Glick on Monday. Heidi, do you have any?
No, I'd like to make a motion.
Got a couple hands on
I
Zoom.
have a question.
Yeah,
Oh, 1 second.
OC and then LeGrand.
Oh, Allegra? Okay, great. OC, go ahead.
Yeah, I'm a little surprised you didn't mention anything about the harmful consequences of plastic beads and how we find them nowadays in toothpaste and obviously in the ocean and get into the fish population. And also there are some new studies that plastic beads actually found in our brains. This was one thing. The other thing is about plastic, bottled water bottles that the plastic actually leach into the water. The chemicals that in the plastic, I'm not sure which one are they, that actually leach into the water if you let the water sit, especially if the bottle is already open. So I think expanding on those terrible consequences of plastic will help because people don't know many of that. And so that's my comment.
Thank you very much for your feedback. I was trying to keep it as condensed as possible, but I think you're right. I think explaining a bit further how we see and ingest plastics in our everyday life would be really helpful. So I'll definitely include that for future presentations. Thank you.
All right, very good. Do I just hit this thing for Allegra?
Should be able-
Yes, yes, I can unmute. Hi there. Thanks. And I'd like to kind of follow up on OC's comment. So, recent work has showed that in bottled drinks, glass bottles actually have a higher amount of plastic, and it is because of the materials that are used in the lids. There's the various resins and just like the paint, the quote unquote paint that we see in our roadways these days is often not paint anymore. It's usually it could be a thermoplastic. It's also a significant contributing factor to plastics in our environment. So I guess my concern is that we want to go after the things that are going to have the biggest impact on reducing the plastic burden in our body. And sometimes, paradoxically, it's the glass bottles because they've got these lids that are leaching plastic into the water that is even higher than what you would expect from a plastic bottle, which we all kind of viscerally know is probably giving us plastic. So I just was curious if there's partnerships with the appropriate places, universities and research units that are thinking will this and meaningfully have the biggest bang for its buck? How much evidence-based practices are going into it so that it's not just a low-hanging fruit that has a small impact like changing your light bulbs. It's the big stuff like, getting off the gas-fired plants and whatnot. Sorry, if that analogy was obscure, sorry.
Yeah, no, thank you for that too. I know I read that study too, and it kind of woke me up a little bit because you would assume that glass would not have plastic in it until you realize the cap and the dyes used. So there's a whole world of packaging engineers who would, we can't really write into legislation how the companies make these shifts, but there is, there's a world that's and a whole industry looking at this. And then also the bill sets up a PRO, packaging reduction organization, that would be working with companies to make sure that they're meeting the increments. And I think that would be an area in which that research and attention would be applied.
So I'm sorry, are you saying the bill would partner with the private sector and not kind of a semi-autonomous independent university research body?
I mean, no, this would be part of the PRO would be set up and be part of the Inspector General's office. So it's not that part isn't in private industry, but businesses, if they are trying to look at how they change their packaging, we can't dictate that they aren't allowed to work with a packaging engineer, or designer in the private industry.
I thought the PRO did have industry members.
Well,
Some of
the
us
PRO
are kind of against that kind of PRO.
I mean, the PRO would be set up to help companies make sure that they're reaching the reduction rates and the targets. But you can't write into legislation that like you have to do it this exact way. Unfortunately, we're not able to write that. So
Well, yeah, I mean, you could, but you probably don't want to because there's only so much micromanaging you want to get involved in doing. Is anyone,
Yes,
is there someone else who has
I
the
think
Q and
that's all your
A?
hands, if,
What?
unless anyone else says, that's all the hands on Zoom,
Okay,
comments and.
Maggie?
well, I wanted to say something about, industry has already messed this act up. I mean, it's been going around for what, 4 or 5 years? And originally, there was 50% waste
Yeah.
prevention in this bill. Industry pushed it down to 30%. And as, you were describing, it's the manufacture of this, which has its own raft of awfulness, right? The borderline communities around the plants where it's made and mined and all of this. And the industry is somehow getting to Heastie, who would not allow it to be voted upon, right? And that has to be fixed. I don't know how we fix that. Obviously, we have to get all the community boards in the state if possible, but is he being bought off by industry? What's happening here?
yeah, I mean, like I said, there's been a huge amount of lobbying done on this bill. And our conclusion is that yes. But I think he also said at the end of session, like, just keep going. So our answer to that is to continue to build grassroots support and make it so that, they can't say no. That's what we're trying to do.
Okay. My other point is to Steve about the other bill, the bottle law, the bottle bill. And, I know that one's been lobbied as well, and that's why all the bodega owners were all up in arms, because the bodega, big bodega came and told them, oh, you're gonna suffer this and that, the other thing. And it's big industry. And the thing is that at making it 10 cents, we'll be able to recover many more of the plastic, of all the bottles.
So that bill is still pending in Albany too?
Yes.
Oh, gosh, yeah.
Yes, and the thing about it is that you've got industry getting to the bodega owners and scaring them with information that's really not correct. I mean, they're saying, oh, the people can't afford 10 cents. Well, yeah, but if they bring it back, they get their 10 cents back.
Well, again, the issue that I heard when we last tried a resolution on it was the fact that they were going to be burdened by having to take in more material, more bottles, and they don't have enough room in their stores. It wasn't this thing about the 10 cents.
Okay.
It was the fact that it was going to be a burden on having to that they were already being having to handle all the existing cans and everything else. They didn't want to take on any more materials. So on a certain level, I can understand that position, but this thing I think is
Well,
is a different tack.
there are return machines.
Yeah, I know, I use them all the time, but let me, I think we don't have any more questions. Heidi, you wanted to make a motion, but I'm wondering if we can maybe hold off till next month. Because I'd like to use this presentation in order to frame a resolution and have something concrete to look at next month's meeting. Would it be okay if we waited a month to pass a resolution?
Absolutely. I do also
Okay.
have a draft resolution.
Oh, yeah,
If you would like,
I thought it was a hyperlink.
yeah, I can, let me pull it up.
Favorite word.
Trying to
Usually, yeah.
slow lift as possible,
Oh, thank you.
right?
Why didn't you send that ahead of time?
Oh, I'm sorry, I thought I
Draft
did.
resolution, that's
Oh.
the dream.
Now I'll write one for next month.
Okay.
Okay, and I'll just share my screen again and, sure.
Can you enlarge it a bit?
Yes, sorry.
Little blurry.
All right, this looks good. Keep going. Oh yeah, I want to put in the numbers of the bills.
Yeah.
We'll specify in that resolve clause, we'll say something about commending our assembly members and state senator for sponsoring the bill and urging the legislature to pass it, whatever. Here are the numbers. Well, we don't normally phrase it that way, but we'll find a way to phrase it.
The board has this specific format, but this is a good starting.
Yeah.
Yeah.
Well, we could do a resolution now.
We could always do a resolution.
No, I mean, we could do a motion now. And then what to say, we could basically say we want to pass this resolution with the appropriate changes. No?
Oh, okay, I hereby make a motion to pass this resolution.
Does anyone want to second that?
Discuss.
I'll second.
Okay, very good. Okay, so all those in favor of passing this motion in support of the legislation, please indicate by raising your hands. Only committee members at the moment. OC and John.
Yes, I'm raising my hand.
Do we see John anywhere?
Yes, he's also raising his hand.
All right, so that's 5. And we only have 5, so that's 5-0-0. That means that nobody's voting no. The guests in the room are allowed to vote. Anybody in favor of this resolution, please indicate by raising your hands. 1, 2, 3, 4, 5. Nicholas is abstaining. Oh, he says voting yes. Mr. Franklin, do you wish to indicate whether you want to support this?
Not at this time.
Okay, so that's what we call an abstention. And that covers us. So we're going to bring this before the full board at our next meeting, which is
27th.
Which is when?
January 27th.
Oh, thank you. Why do you know that? January 27th, and hopefully we'll be in touch.
Okay, thank you all.
And you'll keep us surprised as this legislation hopefully makes its way through Albany.
Thank you all very much.
Okay. All right, and so you can say hello to your parents for me again.
Yeah. Thank you.
Good job.
Okay, next on the agenda is our monthly report from our representative from Health Department. I want to just mention, she'll give us a report on flu, COVID-19, RSV, measles, other matters. Of course, I checked the Health Department website before coming to this meeting. And Pauline, again, I guess all of the neighborhood-specific information and data about COVID-19 is no longer being updated on the website. So all we get is general information on respiratory illnesses in general, indicating last week versus this week. In terms of the percentage of emergency department visits, that last week it was 22.41%. This week it's down to 17.22%. But I have a problem with those percentages because you don't know what the total number is. You don't know whether, I mean, it's conceivable that 17.2% of a larger number could be more than the 22.4% of the previous week. So I got a problem with those percentages. They don't mean that much to me.
Right.
So COVID-19, according to the health department, was stable. Flu, the number of people going into emergency rooms decreased from about 8% down to about 5%. And that's contrary to the information we've been getting, that flu has been on the increase and has been like breaking records all over the state and the nation. RSV decreased by barely, I don't know, 1/100th of a percent. Pauline, I'm sorry if I stepped on your toes, but do you have anything you can say elaborating on the significance of these figures?
No, I mean, I think your point is well taken. I believe that there was a shift in providing such granular data due to funding and lack of resources. But I can just clarify with our team as to why. I mean, like during the height of COVID, we were getting a lot of funding to be able to support, all the reporting and having staff be able to, divert from their other jobs to focus solely on data collection for COVID-19. But as the years have gone by, that funding has diminished, and then staff have to be reappropriated to do other work within the agency. So a lot of our data unfortunately had to shift from very granular information to much more general information. And so this is why we switched from that very specific COVID-19 data page to this respiratory illness data page, where it has the emergency department visits information and then also the lab reported cases as well. So yes.
But could we at least get the number of emergency department visits, not just these?
I actually think
Percentages. Yeah, understood. I think
do.
that the commissioner.
One second. I want to hear from Jacob.
I know the numbers are like impactful to hear a number, but I think as far as trends go, this is really helpful for people to evaluate what's going on.
No, I'd like to have both.
I mean, both is great.
Right. And I think, and I think having both is important. I will bring that back to our data folks. I think that we just released it, like this literally just came out as the meeting started, where I believe that there are numbers, like actual numbers here in this press release.
Yeah.
So Steve, I'm happy to send that to you. But again, I feel like you're right. Like this information should be readily available and easily accessible. Like a lot of people who don't, analyze data on a regular basis, like our website is very difficult to understand. So I definitely, I definitely empathize with what you're saying, and I will bring that information back to our team to see whether or not they're able to just tweak the information provided just a little bit to provide actual numbers.
Okay,
but I'll send this to you in an email after the meeting. Yep.
And I'll forward it to the committee members.
Sure, that would be great. And then also just wanted to thank you so much for the draft resolution that you sent. Speaking about childhood vaccine schedules and the importance to stick to the ones that have been recommended via science. I shared that with the commissioner's team. She was very, very appreciative and thankful that the board is considering passing that resolution.
Hold off for a little while, because I haven't discussed it yet with my committee members, and let's see if the committee agrees.
Sure.
So I think I'll bring it up right after your report, since it seems to go together. So
yeah, as it relates to the importance of vaccines. So we still want to encourage everyone to continue to take the flu vaccine. Again, if you're not feeling well, please stay home, because we're seeing that a lot of people are traveling out and about when they're not feeling well. And so we just really want to make sure that people are staying home if they're not feeling well, and just taking the time to get better. So we do have information on our main page about how to stay safe during flu season, flu, RSV, and other respiratory illness season. And the importance of vaccines. And then, of course, combating the federal government's new vaccine schedule for children. We think it's really important that we get that information out. Also, I just wanted to quickly touch base on, this is like another infograph about how to protect yourself and what COVID-19 and all those other respiratory illness are. And then I just wanted to touch base on OC's inquiries about rabies. So we do have like the final map of 2025, where it has the summary of all of the cases. So thankfully in Manhattan, we see zeros across the board, which is great. It was updated mid-December, so the next update probably won't come out until next week. But I'm happy to share that with the community board as well. If you would like me to just send you a quick email, or if you want to peruse our website, please, I encourage you to do that. And then I know last month in November, Allegra had questions about ticks, and I did circle back with our team. Unfortunately, they are not able to provide, real-time data on our website, but they are actively out there doing tick surveillance, and there is some data and a summary for 2023, and they're working on an updated one, and it should be ready maybe the end of this year. So I just wanted to share that information as well. Like, I understand, that this is of concern to many, many people across the city, and we are doing our best trying to, collate all this information. But again, I know that our website leaves a lot to be desired, and there's information that people want more readily available. And I've made that point many a time. And I'm hoping that, funding across the board for health agencies can be restored. And, we are always trying our best to get the information out to the community that you're interested in, of course, but also just to maintain a flow of information to the community from the agency, so that communities are empowered and can get the information that they're interested in getting. So those are all of my updates for today, and I'm happy to take questions.
Okay, well, here's my question. Have we seen any incidents of measles?
Not as of late, no.
No, not. Oh, okay.
But like, travel is still ongoing, so potentially, but as of right now, no.
All right, because the nation as a whole is experiencing the largest outbreak of measles in over 30 years.
Yes, which is why it's so important to get vaccinated. But yeah, no, as of right now, there have been no additional cases of measles
in New York City. Okay.
In New York City, that's correct.
Yeah, okay, very good. All right, let's keep it that way.
So here, as of January 2nd, there have been no confirmed cases from 2026. But yeah, the numbers remain the same from last year as well. So.
And then there were no cases in 2025?
No, there were cases, but they didn't increase. Yeah.
Oh, 20 cases.
20 cases. Yep.
Well, well, God, look what we had in 2019. But it was the highest number of cases in the last 6 years or so. Okay, all right, thank you. Any other questions?
Yeah,
Jacob? Oh, OC.
Yes, so okay, so this is like I guess it was a Christmas miracle. The tenants from Arden about
the rooster. Yes.
The roosters.
Yes.
So I just asked her again, and she just reported back to me that the roosters and chickens and all various whatever he had there in the yard got removed on December 12 or 13. So she's extremely happy. Everyone are happy on the block.
That's great.
That's awesome. So Christmas miracle. Thank you.
Yes. Thank you so much, OC.
Yeah, you're welcome. Just a side note about ticks, and I'm not sure if if the Department of Health is really tracking something like that, but around June, I got a cat that he had a few ticks on him we got him from Isham Park. Is it something that you guys are tracking?
OC, could you explain that you're a cat rescuer?
I'm sorry.
In what role did you come upon this cat?
So somebody reported a cat that on Isham Park, a very friendly cat. And long story short, I got this cat, and obviously we do all the spay, neuter, vaccination, all that. And the vet found 2 or 3 ticks on him, which is extremely unusual on cats. It is not
Mhm.
something. All right. So I don't know if the Department of Health is tracking anything in that like that, but he was from Isham Park.
Where's from Ocean Park?
Isham.
Isham.
Oh,
ISHAM.
Yeah.
It's up in Inwood.
Right.
oh, okay.
In our district. Yeah, otherwise I wouldn't mention that. So I'm
Yeah,
not
no,
sure.
of course, that's concerning. I will check in with our team just to see. I don't know for sure, sort of what information or how information is gathered when pets are found to have ticks on them. So let me get clarification from the team and I will definitely report back.
Okay. And I think yeah, I have another quick thing about COVID vaccine, and I don't think, I mean, majority of us probably are not aware of that, but there is a new study about the relationship of COVID and chemotherapy. People that receive COVID in certain time while being on chemo, actually the enhance the chemotherapy effect. So I'm not sure if there are any other, if you guys are tracking something like that, or do you know anything about that? And
People who get COVID or who get the vaccine.
no, people who get the vaccine, the people that get, okay, people that are on chemotherapy and get the vaccine around the same time.
Okay, yeah.
The vaccine enhanced the chemo. So I don't know, I mean, like, just it's a side note, if you guys are, if Department of Health is highlighting something like that.
Right. I don't know. I mean, that is a very interesting study. I will bring that back to our team to see whether or not, like, I'm sure there's someone in our agency studying all of these things and, you know, the lasting effects of COVID, like long-term COVID and you know, these sort of correlations between you know, just outcomes. But I don't know for sure. So I will definitely ask and find out.
Thank you. This was reported
Course.
at Nature Journal. This is not from a newspaper, you know.
Journal. Okay, great. Thanks, Ozi. That's so interesting.
Yeah, that is interesting. Allegra.
Thanks. So I was just wondering, you said that the respiratory illness trends on New York City website are just percentages, but you know, clicking around in there, I see the GitHub looks like it has at least citywide numbers that are still available. And for nerds like myself, like I was playing with that data during the worst times of COVID, but for non-native nerds, it can be like a big hill to climb to get at that data in a way that's easily accessible. So I was going to suggest you reach out to this group called beta.nyc.
Okay.
Noel Hidalgo runs this group, and they are designed to be the go-between of New York City's open data laws and community boards and other community groups for whom the burden of like actually accessing the data makes it not accessible. So it is totally within the realm of possibility. For instance, like if you're doing tick monitoring, you don't need to have a fancy write-up. If you can literally just put like the lat long coordinates and like what you found, that's all that's required. It just needs to be in a standard form. And I mean, I guess I'm often talking about this in the traffic committee because, you know, like, you know, every single form that the NYPD turns in is in the New York City open data, and you can, you know, slice and dice this and to have like some really meaningful insight to what's going on around town. The same can be true for health data. And the whole point of this group, Beta NYC, is to help you in a community activism kind of helpful way. I don't even think that you have to pay for it. I think they're supported independently as to be this like supplementary advisory group. And there's a lot of nerdy people like me that volunteer over there and like, you know, make little scripts and do stuff. And you should, anyway, Noel Hidalgo, nice guy, and you should definitely look them up because I do think the data that you're looking for is on the GitHub, and I put it in the Q&A.
Thank you.
Thanks, Allegra. I'm gonna have to explain GitHub to Steve now, but that will be
yeah, that's great information. And yeah, I mean, I unfortunately, I don't know why the data that we provide is so hard to navigate and not easily accessible for people who are not, well versed in data research. But anyway, thank you so much. I really appreciate it. Sorry I couldn't make it last week. I came down with that crazy flu that was going around. My whole family was knocked out. But
Oh, well, no,
Happy
you're
New
not,
Year.
didn't they tell you, you're not supposed to get it?
I know I had the flu shot and everything. No, we do
Okay.
encourage everyone to
Okay.
continue to take the flu shot. Stay healthy, everyone, and Happy
Okay,
New
well,
Year. Thank you.
Before you go,
Yes.
did you find out when the next community health profile might be published?
Oh, right. They said that they're working on it, and it's every couple of years. This was not specific at all. And so the next iteration should be coming out, I believe, next year.
You did 2027.
I believe so, but I don't know for sure. And
Okay, so-
I will definitely try and get a more substantial response. But yeah, I was told that, obviously it takes a while to gather all of that data and to have the
Right.
data be significant enough to produce a report.
All right, so really the report that I should refer to is at this point is still the one from 2021.
That's correct.
Okay, very good. Maggie?
Yeah, so the Manhattan Solid Waste Advisory Board, early on in the COVID time, noticed that COVID is being found in sewage, water. And it actually is about 2 weeks before the spikes occur. You can actually see it in the sewage. And I'm wondering whether the health department is making use of that, because it took us a lot of banging away to say, look at this, look at Boston's figures, and it was correlating so nicely. And I heard that health departments were starting to use it, but are you?
Well,
To predict surges?
I think I remember that during the height of COVID, either the health department or maybe DEP, somebody was looking at it.
It was DEP with the wastewater, and they were sharing information with the health department, but I'm not sure currently whether or not we are surveilling data coming from wastewater management.
With a 2-week warning, you get to know in advance, of when something's about to spike.
Okay,
And
well-
it's not just COVID, it's anything. You can measure all of it.
Okay, well, we could let's make a note. We could check with DEP on that. Okay, thank you, Pauline. Thank you, Allegra. Allegra, have I ever told you how much I appreciate you coming to these meetings?
I like hanging out on these things.
All right, because
I like my community. Inwood's the best. It's the best.
Well, I tell you, if you saw that story, I think it was on Channel 7 the other day, about how Inwood came to the aid of this woman who lost $300 of her rent
I
money.
saw her Facebook post.
Yeah. At the
Everybody
bagel
saw
shop.
her Facebook post. I was like, oh man, that stinks. And everybody else is like, I can help.
Yeah, well, one guy says, I'll put up $10 if 2 other people will also put up $10. I looked at that and said, well, that only gets you $30. What the hell good is that? The woman needs 300. Within 24 hours, enough people put up money, and then she got back to $300. That's a great great story for Inwood. I'm off topic here. Okay. Okay. So listen, let me go out of order again and bring up this resolution that I circulated, commending the acting health commissioner for responding to this awful decision by R.F. Kennedy Jr. and the Centers for Disease Control to reduce the vaccination schedule from that would cover now only 11 instead of 17 diseases. And so, this is somewhat unusual for us. We usually don't just pass resolutions commending people. We usually, actually, fairly often, we're just passing resolutions urging action of one type or another, or complaining or opposing actions that are being taken. But in this case, I think it's worthwhile to point out that the city is maintaining its commitment to protect the health of our children and insisting that the healthcare providers continue to provide the vaccinations according to the previous schedule and not fall prey to this crazy Trumpian decision. So I don't know if I hope people have had a chance to read the resolution that I wrote in the middle of the night, and you know, I don't know. Do people have any comments on it?
Not on my end.
I'm sorry.
I said not on my end.
Oh, not on your, okay. Do you support the resolution?
Yes.
Okay. All right, do I perhaps hear a motion?
Motion.
And Mr. Banis, are you moving that the committee support this resolution?
Yes, thank.
Is there a second?
Second.
I'm sorry, you're too late, and Ms. Guzman already said she seconded it. So all those in favor of this, passing this resolution and forwarding it on to the full board, please indicate so by raising your hands. There are, 1 second, well, I didn't call on you yet. It's there are 3 in the room, there are 2 out on Zoom. So that's once again 5 to nothing. That means that okay, then the guests in the room, all those in favor of passing this resolution in support of the city maintaining its commitment to provide vaccinations. 1, 2, 3, 4, 5, 6. Nicholas is abstaining. Oh, he's 7. And so that resolution passes. Thank you. Thank you all. This is unusual. We usually I don't know. I don't remember the last time we actually had 2 resolutions. All right, next on the agenda. A report from New York Presbyterian Hospital, Mr. Batista.
Hi, Steve. So I had access, I was given access to the dashboard to try to get the, the COVID numbers. I'm not sure, whether I was doing this correctly, but I did reach out because the information I was getting was not really current. This is just prior to Christmas. And it doesn't break it down really by Ward 12, so by the Columbia campus. And I'm not sure how accurate, there's a host of things, but in terms of influenza, it noted that, and this is all system-wide, not just Columbia, was 1,924 cases. And then we had 42 COVID cases. I will work on this.
1 second.
Again, these are not broken down by campus.
No, I said, but 1,924 COVID cases.
No, those are influenza.
Oh, flu. Okay.
Right. And 42.
42 COVID.
Right.
And this is as of what date?
This was as of 12/24.
Christmas Eve.
Yeah.
All right.
Yeah. I mean, I'll sort of work on this, now that I have access to the dashboard.
Okay, would appreciate if you would include this in your regular monthly reports.
Yeah, I'll continue to, now that I have access to it, so maybe easier, but again, I'll have to see whether somehow it's broken down by campuses.
And can you comment on whether or not the hospital intends to continue to provide and recommend that the previous vaccination schedule be continued?
I will follow up, but my assumptions is that we will continue to proceed as we always have, and not follow the mandates that CDC has or the Kennedy has prescribed. So we're following your resolution.
All right, good. About time you followed one of our resolutions. Okay.
So I just also want to touch upon one other thing, and I know that we have a lovely nurses here, and that's great, and you're hearing from them. I just like to and we'll probably echo is that, there are negotiations still taking place. Hopefully we will continue to negotiate on through, if need be, through the weekend until we find and hopefully come up to a resolution. Hoping for that. I understand there is a mediator in place as well. We hope for the best. We also plan for the worst, unfortunately, and focus really will continue to be to ensure that patient safety and their well-being. Hopefully it doesn't come to that, but the hospital has taken measures to ensure that we will continue to service patients in the community. you know, look at all the different scenarios, but we are prepared, and hopefully will not happen. Hopefully will not happen, that if, strike takes place, we do have measures in place to continue to provide care.
Okay, did I also hear that you've started to move patients to other locations?
They're within this hospital system, correct, from Columbia.
Within the NYP system?
Yeah, correct.
Oh.
Yeah.
But so is Columbia the only unit that's affected by this?
So this involves numerous hospitals, throughout New York City and Long Island.
Right.
For us, it's really Columbia because that's where NYSA has its membership.
Oh, yeah, so you have like 9 other hospitals.
Right.
They're not affected.
They would, like Brooklyn has a different schedule.
Oh.
The contract schedule.
Oh.
Cornell doesn't, is not member of NYSA.
Oh.
So the only one that's impacted by this current contract.
Oh, I didn't realize that.
will be
Okay,
Columbia.
okay, all right.
But again, I know that everyone's working digitally and
Yeah.
hopefully we'll get a contract in place before the weekend.
Right, so Monday is the
Monday is 7 a.m.
7 a.m. is the date in which the union has said if there's no agreement, they're prepared to walk.
Correct.
Okay, all right, well, why are we here from the union? Are both both,
Be here in a minute.
who will be here?
If you want, we were after MJHS.
Yeah, I know, but okay, I mean, we could, okay, I thought I was gonna bump you up, but that's all right. So, so we're waiting for both Sophie and Angela?
This is Angela right here.
But thank you.
Oh, this is Angela.
Diego.
No.
Okay,
Julio. Oh,
You're
sorry, I'm
you're after
not
Diego.
Okay, yes.
okay, all right, so we're gonna move on then, thank you. So, I have a report now from the Columbia University Irving Medical Center, Diego Quintuna, Community Affairs Coordinator. Diego, go ahead.
Hi, everyone. Good evening. Can anybody hear me?
Yes.
Perfect. Okay. Good evening, everyone. Happy New Year.
Happy New Year to you.
So here are our updates. Sandra is also on the call. So to begin, our research and academic highlights. So iron deficient diet prevents lung cells from fighting the flu. So researchers at Columbia University Irving Medical Center have found that a lack of dietary iron early in life can prevent immune cells in the lung from making a key protein that helps fight viral infections even after the iron levels are restored. I included the hyperlink there so you can read more. For teens, any cannabis use may have impact on emotional health and academic performance. So using cannabis just once or twice a month is associated with worse school performance and emotional distress for teens, according to a large national study of adolescents led by Ryan Sultan, an assistant professor of clinical psychiatry at Columbia University of Vagelos College of Physicians and Surgeons. And about 1 in 5 high school students currently use cannabis, and approximately 6% of 12th graders use it daily. So that's a rate that has increased in the past decade. And I also included a hyperlink there.
Yeah, but isn't it possible that I don't know how this is going to sound, but isn't it possible that maybe it could also be the other way around, that in terms of cause and effect, that it's kids who are already experiencing emotional stress who then turn into using cannabis?
Yeah, that may be possible for sure.
What's the old saying? Correlation doesn't equal causation. So
Yeah.
there's something.
Yeah, I mean, I'm willing to, yeah. It may be a little more complicated than what you see at first glance. But okay, I'm sorry. I didn't mean to interrupt. Go ahead.
No worries. Just a brief update on school leadership appointments. So Dennis Mitchell, professor of dental medicine, has been appointed dean of the College of Dental Medicine. And also Kathleen Sycamore, Stephen Smith, professor and chair of the Department of Socio-Medical Sciences, has been serving as interim dean of the Columbia Milliman School since July 1st of last year. So those
Yeah,
are just like quick
we're
updates.
just finding out about it right now. Oh gosh. Oh, she's been the interim dean since July.
That's correct.
Wasn't there also a very significant appointment of the head of surgery? Is that at the hospital?
Yes, but we haven't even had his reception yet, so we can announce it to you. Yes, we do have a new head of surgery. And we'll be announcing it soon. Yes.
Yeah, you can only announce it after you give him a reception?
Well, we gotta welcome them into our community and then bring them to you, Steve.
I said, and you're not
So
even
I'll
planning
bring all
to,
of these appointments to the board as well.
okay, you're not even planning to invite us to the reception?
I would invite you, but everyone knows that you don't show up. But I will definitely send. I see that. Yeah. Yes, Steve.
Okay, very well, you know,
We have to
I'm-
work on you showing up to our events.
Yeah, okay, I'm doing my
You
best.
can bring them
I-
here
I-
so we
I-
can haze him.
Yes.
It's my intention. My intention is to be there, but then I get called. I get assigned to do other things. Okay, where's Diego?
Okay, go ahead, Diego.
I've had enough. I've had enough of you now. Diego.
Upcoming events and other opportunities. So community chat, they are hosting a healthcare navigation session at the Mara Senior Center through the Office of Community Health on Thursday, January 15th at 2 p.m. This session will focus on healthcare navigation and how to talk to your doctor. Anyone that's interested, any interested seniors may register for this event by contacting Moriah Senior Center, and I provided their email and phone number.
Yeah,
and I also
Mariah.
Yeah, Moriah Senior Center, and I also highlighted the individual Hannah Thompson, who leads or oversees the community chat. And I added her info as well. And they're also hosting a community chat at the North Manhattan Improvement Corporation on Wednesday, February 4th at 3 p.m. And this community chat will focus on oral and dental health. This presentation will be in Spanish and will focus on dental care best practices. And if anyone's interested, you may also contact Hannah Thompson to learn more. Another event that's coming up is Saturday Science, Your Brain in Bloom. So this event, explore how brains grow, adapt, and bloom on February 28th from 1 to 4 p.m. at the Columbia Jerome L. Green Science Center. There will be hands-on activities and interactive demonstrations, and you can learn how the brain develops throughout life. This event will be held at 605 West 129th Street, New York, New York. And I made a small error. I forgot to include the Eventbrite link, and I'll send it over to you ASAP.
Okay, do me a favor.
yes.
When you send over the revised piece, could you include the addresses for the Mariah Senior Center and for Northern Manhattan Improvement Corporation?
All right, I'll definitely do that.
Yeah, put in the addresses.
Okay, I'll do that. Thank you.
Yeah.
The State Pre-College Enrichment Program, SPREP, this is a free high school and college preparatory program designed for 7th to 12th grade students who are interested in pursuing a career in medicine and work-related STEM fields. The application for the summer programming will be released on February 1st, and the deadline to apply will be April 15th. And I included the hyperlink there to learn more on how to apply. The Medical Center Neighborhood Fund, MCNF. So any community-based organizations that serve Washington Heights and Inwood, they're invited to apply for funding that supports recreation and arts programming, social services, food insecurity, and other essential community strengthening programs. Eligible organizations may receive up to $5,000, and these grants are made possible through the generous contributions of employees from Columbia University of our Medical Center, New York Presbyterian, and the New York State Psychiatric Institute. And the deadline to apply is January 28th, and I also include the hyperlink there for the online application. The Yes in the Heights program at the Herbert Irvin Comprehensive Center is a summer internship for high school students and undergrad students that aims to increase the pool of youth entering STEM fields. And this is an 8-week program, which includes a formal orientation and hands-on scientific training and much more. And the deadline to apply is January 9th. And I also include a hyperlink if you want to learn more about that. And a few events that are coming up as well, the North Manhattan and Harlem Neighbor Appreciation Days. So these are two basketball events. The first one is on Monday, January 19th at 2 p.m. Columbia versus Brown, women's basketball. So any families that reside in Washington Heights, Inwood, or Harlem, they are invited to enjoy 4 complimentary tickets, and the match will be held at the Levian Gymnasium at 3030 Broadway, and they could claim tickets there with I included the hyperlink, and another game on Saturday, February 21st at 2 p.m. Columbia versus oh my God, I always mispronounce their name, Dartmouth, men's basketball. And again, free for families.
So this
What?
gym is
And the
on
Morningside
the
campus.
Morningside Heights campus, right?
That is correct.
Okay.
And
Yeah.
I also included the hyperlink there if you're interested.
Yeah.
Heroes Night, the basketball game.
I don't know if you're already doing it, but you have 2 games here with Brown University, and I don't know. I mean, you might want to
The women's basketball, the
somehow.
men's basketball.
Yeah, you might, Brown experienced an awful incident of gun violence with 2 of its students who were killed in December. I don't know if there's how you might want to acknowledge that in some way, but
Yeah, they usually do within the program of athletics. One of the things that we're trying to do is really bring a lot of our sports and youth program organizations to really take part and really see that camaraderie within the athletics sports field and so on. So I'm sure that our coaches are going to definitely acknowledge this in a way of
Yeah.
support for the
Yeah.
school.
yeah, that would be appropriate.
Yeah. Yeah.
All right, Diego, you still have more stuff, Diego.
But we still want to beat them at the game. All things, yeah. Go
Okay,
Lions.
but do it nicely.
Yeah, well,
Yeah, in a non-violent way.
I'm sure.
Yeah.
At the court. Mhm.
And we had our campus holiday initiatives, the hands-on STEM initiative, the hands-on science, technology, and engineering and mathematics STEM initiative. It provides essential science supplies to classrooms in Washington Heights and Inwood. This year, thanks to the support of CYMC faculty and staff, we were able to support several Donors Choose projects created by local educators, including PS48, PO Michael J. Bugzeg, PS8 Louis Belliard, and PS128 Audubon, and PS115 Alexander Humboldt.
This is fantastic. Is this something you do every year?
Yeah, this is part of our holiday drive. So we started doing the Handsome STEM initiative, supporting local classrooms. So this year, many of our schools have joined Donors Choose, which is a platform where teachers go in and, sort of fundraise for their projects. So we were able to identify teachers within our community and encourage our faculty and staff to support their initiative. So we're really happy that these schools' wishes were fulfilled.
And you fund Donors Choose projects every year?
Yes.
That's fantastic. That is great.
And
okay, you got one more, Diego.
Yes, our annual toy drive. We held our annual toy drive this past December, encouraging faculty and staff to donate new toys in support of children and families in Washington and Inwood. The toys were collected through campus-wide drop-off locations, and we also have our Amazon wish list. And the toys were distributed to the Washington Heights Child Care Center, Fort George Community Services, the 33rd Precinct Community Council, and the Washington Heights Guardian Angels. And that's the updates that we have for this month.
This is a great report. Really appreciate the effort you put into this and how good it looks. I got to get the community board to send this out to the general public, to our regular distribution list. So
thank you. I just quickly wanted to also just give you an update on the research funding.
Yes, please.
At Columbia. So, as you know, for FY26, our president proposed a 39% cut to NIH. Luckily, our Senate and everyone pushed back, and we actually got an increase. The Senate gave us an increase of 1%. So the numbers for Columbia, right, in terms of our research portfolio, we're only looking at a 4% decrease in terms of our funding, from 526 million to 503 million. This is just preliminary numbers, just looking at our scope. One of the issues to keep in mind for the administration in terms of competitive grants, Steve, is that there has been an effort to really fund states and other institutions in other parts of the country that don't traditionally get this funding. So we're still waiting to hear on some of our major grants around that. We still don't know how that's going to go, and that's where you see that decrease a little bit. We're still working on the indirect rate. That is still something that is up for discussion. Columbia has joined other universities in endorsing the FAIR model. So as you know, the state funds us for research, and there's a certain percent that goes for indirect costs, meaning maintaining facilities, staffing, and everything that has to do with supporting these grants. The administration had made a push for 15% indirect, which is definitely not acceptable, but that is still in the works. Even with all the conversations that have been going on, the indirect rate remains the same on the existing grants. So no changes there, but again, a lot of conversations around moving that needle. So we're still pending on that. So another area for us is Columbia has joined other academic research institutions in New York City to propose to the Governor Hochul to fund the Empire Biomedical Research Institute, meaning helping New York State create an institute to fund research scientists. We have been, over the years, losing scientists to California, Texas, for lack of funding. So we will be coming to the community board and beginning to do a lot of grassroots advocacy along with other New York State academic research institutions to push for this. So more to come on that. We're at the early stages, but definitely beginning to roll out the conversations at the grassroots level, and also with policymakers to push that forward.
Yeah. Are you done?
Yeah. Mm-hmm.
The 503 million in research grants, is that for fiscal year 26?
Yes, this is what is looking for us for FY 26.
All right.
Yeah.
And that's all for the medical center?
That's all for our medical center portfolio, correct?
So what concerned me was the fact that I thought you had lost at least $200 million, because the original cut from the Trump administration was 400 million, and then you negotiated to pay a ludicrous penalty of $200 million, and so in order to get back to 400, so you had a net loss. You had a net gain really of only 200 million, and you lost 200 of the original 400. So, what was the net result of that? I mean,
the net result of that is, while we have the funding has been restored gradually and slowly, given all the changes that have happened within the administration. But remember that we're no longer getting funding for those grant awards that are not within this government structure, meaning a lot of our DEI, community engagement, a lot of our environmental sciences research. So when we still don't have those concrete numbers, but there's no longer an effort or willingness on the part of this administration to review these proposals for research. So
so I think this committee, would be particularly interested in knowing what is the environmental research that you can no longer carry out. Well, what did we lose in this drastic change in federal policy?
Yeah, so those are the grants that we're still assessing in order to come back by schools, right? So we know that our School of Public Health has been tremendously impacted by a lot of these cuts. So that is part of the inventory that we're doing across our medical center. But again, I mean, it's a significant number of environmental health research on DEI.
And there was a particular research project that was undertaken by a professor at Mailman, I believe, on the effect of noise in Washington Heights and Inwood, and that project was curtailed, or but I'm wondering, was it ever restored?
I don't think that grant that research project was impacted, because I think it had concluded. I can definitely check on that.
Yeah,
But
please.
I distinctly recall, and I would need to check if it was part of the federal grants portfolio. It could have been another division, but I'll double check. But my understanding is that research
Oh,
had.
I was told at one point that it was suspended because of the federal research cuts.
I will need to check. Is this the one with yeah, I will need to check on that. I don't believe it's part of that portfolio.
Yeah, I think there were noise meters that were being installed in people's apartments to measure the impact on their living conditions or something. I forget. I can find out the professor's name is going to be in one of our minutes from about a year
Let
ago.
me know, because I believe this was part of our Department of Children's Environmental Health Sciences division.
Yeah.
But let me know if you find it, and I'll definitely
look for it.
inquire within. Yeah.
Okay, thank you. All right, any other questions for Ms. Harris?
Just, I signed up for that particular program to get a noise level meter, and I never heard from them again.
All right, good, thank you. So I don't think that study was, I think that study was in fact suspended and maybe has yet to be revived.
Okay, so I will follow up on that.
All right.
Steve, I have a couple questions.
One second, is that Allegra?
Yes, sorry.
Yes.
1 second, I'm not up to you yet.
Allegra, before we get, one of the things that I do want to bring up that is definitely concerning us as part of these, I call it the 1BB. I refuse to spell out the name on that bill that we know that is out there. That is really looking also to limit the amount of funding of loans that our students can take in the in medicine, in public health, and in nursing. So as you know, there has been an effort to deprofessionalize nursing, public health, and social work. So we're working again with other institutions to address the issues on this bill. And just so that you know, the level of loans and funding that you get with these professional careers, these are professions. So the BBB bill that has been presented is considering to deprofessionalize these professions. This is, poses great risk for nurses, social workers, public health professions, and there's some even in dental in the graduate level. So we will be coming back with more information on this, but this is something that is very concerning as well.
Yes, disgusting.
Mm-hmm.
I mean, to deny that all of these important professions are no longer professional, it's insane.
Yeah.
All right. Thank you, Sandra. Thank you for your unexpected appearance here today. Any other committee members with questions? No. All right, Allegra, it's your turn.
Hi, thanks. So I was just trying to type them in. So during the intermission when no federal grant dollars was flowing, what fraction of requests for bridge funding from your staff did you support? That's one question I have.
Mhm.
Another is like, is the FNA at the medical center the same as main campus? And I think that's 65% on the main campus, but it kind of changes around depending on which campus.
Right.
So what were those initials? What was that?
Oh, the Columbia Medical Center, they toss in the I is for Irving. So it used to be CUMC, but now it's
No.
CYMC.
I thought I heard you say something like FNA.
Oh, so the indirect costs or the
Indirect
facilities and
costs.
administration, sometimes it's called overhead. It's like
Right.
at the very end when you're finished writing your grant and you've paid everyone's like insurance
Right.
costs, then there's a multiplier. And
Yeah.
in the case of main campus of Columbia, that multiplier is 1.65.
Yeah.
Yeah.
So so on our campus it's about that 65% depending on the grant, but on average that is the number. And in terms of bridge funding, so the way we handle a lot of the bridge funding, many of the faculty researchers sort of submitted their grant proposals and the things that were outstanding. We prioritize a lot of the grants that were terminated that had implication for patient care. These were grants where we had patient enrollment that would be at risk. So all of those were prioritized and were funded until we determined that it was going to be refunded by the administration. And to this day, we continue to extend those bridge funding as we seek alternative sources of funding.
Okay.
In instances where we know that the government is no longer interested in funding these types of initiatives. So we do continue to provide those bridge funding.
And the other question I had is like a lot of institutes, like the H-1B visas costing, is it the H-1B, the 100 grand thing? Like, has this impacted the kind of physicians and support staff that are, does Columbia have a plan, or everyone's kind of hoping this thing will go away, or?
Yeah, so there has been a lot of support with legal in looking at that, and even some individual funders and donors looking at that issue. But we're still measuring that, as you can imagine, on a day-by-day basis, and definitely lending support to all of our students. We continue to see some impact, not as much as we thought we would with some of our international students, but we're dealing with it day by day. Yes, it is
Right.
very much on our radar, Allegra. Yeah.
Yeah, and I know for like, some of the grants that got funded, I mean, sometimes it's things like literally like women's health and issues that are
Mhm.
specific to like, female bodies. And so it's hard to avoid saying like the word woman in your grant. And
Well, that is your thanks, Allegra. So there is also this whole terminology, all these things that we can say. So one of the ways that we're going about this is providing a lot of hand holding with our faculty and retraining and in resubmission for these grants. So you're right. There's a lot of sensitivities. Believe it or not, there's a list of words that we can.
yeah, there is.
Believe it. I mean, we were shocked, but there actually is. But again, we have currently a task force in place looking at how do we continue to do the research that we strongly believe in. And looking at sources of funding and really supporting our faculty, especially our junior faculty. This means a lot.
It's really tough for the junior
them, and it's
people.
very, very tough. So we're doing a lot of support building for our junior faculty, for our research community in this research areas that we truly believe in. So it's been a lot of work.
So I know in my little corner, Columbia's been a mixed bag of help for like, the uncertainty of federal grants. Like in general, like a lot of our departments, you have to front load by 3 months. And now they're saying, Columbia's saying like, now we'd like you to front load by 12 months,
Yep.
which increases exponentially the burden on individual researchers. So yeah, I'm curious to hear your thoughts on that, because from the other side, it just makes it pretty gnarly. I get Columbia's motivations, but on the other side, like, that's a lot of front loading.
It is. And I can tell you that we have a task force that's aggressively looking at how we respond to this, how we tap into other sources of funding to continue to do this. And we still wait day by day, because remember that there was disruption in the system. So even with those grants that have now been funded, just getting them back on cycle on the review. I mean, we have a major grant that we've been waiting since October just to hear the status on the review of that grant. So it's very slow. That's what I can say. We're going at a very, very slow pace. And we continue to work in supporting our faculty with the bridge grants and also identifying other sources of funding.
Well,
All right,
hopefully minibus, like everyone knock on your head wood, the minibus, hopefully the Senate votes in a nice way on Monday and we get some NSF funding flowing again. So everyone knock on your wood.
Yes, we are. We are.
Sandra, were you reading from some notes earlier on the research grant issue?
Yes, you want me to share some notes for your minutes?
That's a great idea. I wish I had thought of that. Yes, could you do that?
Will
all
do.
right.
Will do.
All right, thank you. Okay, thank you, Sandra. Next up is Isabella Geriatric Center, Diane Ashley, Director of Marketing and Communications.
Good evening, everybody. Our numbers are good. We have one resident at the moment with COVID and one resident with the flu. None with RSV or norovirus. So numbers are looking pretty good, especially considering the heightened flu season, although I heard at the beginning of this meeting that perhaps we're starting to see a little reversal in that. 70% of residents have received the flu vaccine. So we constantly try and administer, but as we've discussed before, we offer and encourage and inspire, but we can't require.
Yeah, and what did you say? You don't have any COVID cases, is that right?
We have one COVID case.
One COVID case. Oh, okay. And that person is isolated.
That person is isolated.
Okay. All right. Any questions from the committee? Anyone else out there? No, very good. All right. Thank you, Diane.
Thank you.
Okay. New York State Nurses Association. I think Sophie Boland is now here.
Here.
Okay, very good. Sophie, this is what, your third time here?
Yeah.
No,
I've never sat.
Oh, no, oh.
They were sitting before.
no, this is your first time in person?
No, I think I've been here in person.
Well, you're once in person, once on Zoom.
Maybe, yeah.
Okay. Why don't you guys you can
Okay.
sit down?
I feel like I've always just stood and.
Well, today we have extra chairs.
Thank you. So yeah, my name is Sophie Boland. I am a nurse at New York Presbyterian and the Children's Hospital. I work in the pediatric ICU. I'm also on the executive committee and bargaining committee for our local bargaining unit. We're in negotiations right now. And we have been since August with little to no progress. We have a number of issues that we absolutely need to address in our contract to protect nurses, patients, and the community. And as you know, we gave our 10-day strike notice. So I just want to go through the issues that we're fighting for and why we feel they're crucial for our contract. So number one is safe staffing. We need a mechanism to hold NYP accountable to safe staffing that we fought for in contracts before. NYP violates our staffing in our contracts and then forces nurses to fight them in court through the life of the contract to resolve these issues with no end because they have incredibly expensive lawyers that enable them to do so. Via our current language, for example, the CTICU in Milstein, that's the cardiothoracic ICU, went to arbitration over their short staffing. The arbitrator awarded them a make-whole remedy for their short staffing.
I'm sorry, what was that word?
A make-whole remedy, so.
Make hold?
Yes, make whole.
Oh, make whole.
Yes.
Oh, I'm sorry. Yeah, okay.
So, the arbitrator just found through their evidence and through their testimony that they were critically short-staffed. It was a patterned, over a period of like over a year.
Well, in any particular units?
This is the cardiothoracic ICU, the adult cardiothoracic ICU.
Okay, I'm sorry.
No, it's fine. And the arbitrator decided that the nurses had worked so short that they were entitled to an award. To penalize the hospital for short staffing in such an irresponsible manner. It's a mechanism that we found incredibly successful in other hospitals that have similar language, to help hold the hospital accountable to the staffing that they promised us in our contracts, and the staffing that makes our patients safe. So in other hospitals where they have this language, nurses have been awarded compensation for being forced to work short. The conditions where you're forced to work short are some of the hardest shifts you ever go through. These are the shifts that burn out nurses. These are the shifts that put patients at risk, and it's completely unnecessary. In other hospitals, the nurses have been awarded money. There's remedy that comes, and the short staffing is curtailed. But instead of facing those, instead of just, going with what the arbitrator said, NYP instead has appealed the arbitrator's decision. And yesterday the CTICU nurses were in federal court of appeals, where the court heard their case, and it's still not resolved. And this is now 3 years later. So we need to resolve these and other issues in our contract, and we need a mechanism to do it, not in 3 years. So number 2 is job security. I've come to this board before to notify you guys about layoffs and service cuts that NYP has enacted over the last 3 years, because the richest hospital in New York puts profits over the care of their patients and their community. They eliminated the midwifery service at the Allen, partial closure of rehab, closure of the palliative care unit, closure of the peds infusion clinic, and elimination of the nurse practitioner service overseeing a specialty peds inpatient unit. We need to protect our nurses' jobs and the services that this community needs. So number 3 is workplace violence. This is especially important today. NYP at Brooklyn Methodist had a violent incident that resulted in police responding to the hospital unit, and police ultimately fatally shot a patient who had a weapon.
Well, what?
This is today, 6 p.m.
New York Presbyterian,
at
Brooklyn Methodist.
And then several months ago, Mount Sinai also had a violent incident at their hospital, where an armed person attempted to gain access to the hospital with the intention of shooting and killing people. So we need mechanisms to hold the hospital accountable, to protect nurses and patients in the hospital.
So there's been no advance at all on this issue, on the workplace violence issue?
We have no progress on any of our proposals. It's really alarming, and Angela's.
There's no agreement on anything right now? Nothing?
Nothing.
I think maybe a tentative agreement on virtual nursing.
Yeah.
I'm sorry?
So we
like one proposal on virtual nursing.
We have a virtual nurse program that's rolled out in the hospital over the last year. So a year ago.
There's an agreement on this?
There's an agreement on this, but we started this agreement 1 year ago.
Yeah.
Because it was a program they rolled out,
Right.
in the last year.
So is this like telehealth or?
It's similar, yeah, but it occurs in the hospital at inpatient unit. So there's a virtual nurse that's on a screen, either the TV screen is utilized or there's a computer that's rolled into the room, and the virtual nurse does admissions and discharges. So we had language surrounding how that would be utilized in the hospital.
Well, somebody gets admitted without actually seeing a real person?
Correct.
Really? That can happen?
With the patient has to be agreeable.
Oh, well.
They have to meet certain criteria, but yes.
They don't get seen by a doctor or?
They would get seen by a doctor. The virtual nurse helps with like the documentation. They'll ask them the nurse is still responsible for assessment, but the virtual nurse helps with like the documentation aspect.
Okay, but a doctor has evaluated the patient.
Yes.
And determined whether or not that patient should be admitted.
Yes.
Oh, okay. Well,
And was that designed to alleviate like the concerns about understaffing?
We, so that was part of our language, is to ensure that the virtual nurse doesn't change any staffing. We need the staffing that we currently have. The virtual nurse, the the way that the hospitals explained it to us is that the virtual nurse is supposed to help with documentation and the burden of documentation when a patient's admitted to the hospital, because sometimes.
So it's okay.
Wait, but what if the patient does not want to speak to a virtual nurse? They want to speak to a nurse.
They can choose not to.
All right.
The nurse makes the assessment if the patient can meet the criteria, and then it's ultimately up to their decision.
All right, so they have, it says the patient's option.
Yeah.
Yes.
Okay, I'm sorry, go
And it
ahead.
was part of our language as well to ensure that nurses don't have to use it if they don't feel it's appropriate. Patients don't have to use it if they don't feel it's appropriate.
Right.
It's only meant to be a tool if it can be used appropriately.
And would this, wouldn't this also possibly be beneficial if the person is not English speaking? That you would then be able to provide them with a nurse who can speak the language?
Yes, but it wouldn't be that nurse providing that service. It would be, we have to reach out to an interpreter. So technically it would be either another step or, yeah.
But the virtual nurse can then use the interpreter to talk to the,
Well, but what if the virtual nurse already speaks Spanish?
yes, then they can,
Well,
but
the
that's
person in the
not,
hospital can also speak Spanish, so
Yeah, but.
it's twofold.
Right.
yeah.
Okay.
Yes, yeah.
Okay, all right, I'm sorry, go ahead. I
Um,
don't want to negotiate a contract right now.
yeah, we could use your help.
Okay.
Yeah.
But yeah,
Okay.
again, we wish that we were making better progress because,
Well, you only have like 3 days left here.
right. So, our next, big issue, talking about technology, is AI. So it's in the hospitals already. We need to make sure that it doesn't erode nursing jobs. And we need to ensure that nursing clinical judgment, stays with the nurses.
How is it currently being used?
So, we know from our delegate in, the ambulatory care network in the clinics, that they often use, or they have an AI tool, when they communicate with patients via like a secure chat through their chart, like
a portal.
Yeah, through like the patient portal. And there are times when the nurse will like type a response to a patient question, and they have an AI tool that generates like a quick answer. So you can choose to use that answer to respond to a patient. But what the nurses find is that often, like AI does in so many other areas, it fabricates these like false answers that are like totally wrong. And in healthcare, they can be dangerous. Those wrong answers can be dangerous. So we need language in our contract that ensures that nursing clinical judgment will always come first, that AI is a tool, but it's not meant to replace nurses.
And is that being contested? It seems so rational, logical. Like that, so there's no agreement on that?
Wow.
We also want to make sure that we're not ever replacing a nurse with AI, and that's something that NYP will not agree to. They turned over a counter proposal today, telling us that they will not agree to that. Our last issue is wages and benefits. These are so important to recruit and retain experienced nurses, because we want the best nursing care to be found in this community. During COVID, nurses were at the front lines, and when other providers and hospital personnel weren't going into patient rooms, nurses were. Many of them got sick, and now NYP wants to force nurses to pay for their health care with no increase in wages, and also gut our health care. And I'm gonna hand it over to Angela because she's gonna talk a lot more about where we are right now, and what our plan looks like.
So
I'm sorry.
Yeah, go ahead.
Would you be able to send us your notes?
Oh, of course. Yeah.
Okay, I'm sorry.
It's okay. My name's Angela Durso. I work at the Allen Hospital up in Inwood.
And what do you do there?
I'm a nurse on the inpatient step down unit, medical step down, and then I float to also the spine unit because that's mainly the spine hospital. So they do a lot of spine surgeries there.
And then would you happen to have any dealings with the psych unit?
I don't float up there, but they recently just switched from this hospital to
Right.
that hospital. So more, if those patients need medical interventions, they will be coming to my unit.
Right. No,
So in that
I
respect,
know.
but
We have a particular interest in the fact that that unit has finally been restored after years of our advocacy here to try to get that unit back after it was gone for about 5 years. So just want to make sure that it's being fully utilized.
it is, it's a very nice unit.
Okay.
And then I think they're restoring the one in
Bilstein,
Bilstein to
yes.
hopefully have two.
Yeah, exactly. Yeah. I'm
Um,
sorry. Go.
No, it's okay. So as Julio said before, that NYP Columbia is the main NYP system in Manhattan that has New York State Nurse Association nurses,
Right.
union nurses. Yet we're hospitals currently at the table negotiating a contract are Montefiore in the Bronx, Bronx Care, Mount Sinai Maine, and Mount Sinai Morningside West. So these 5 hospitals are currently still at the bargaining table and have not made significant movement and have any hopes of settling a contract prior to a strike next week.
And they're all facing the same issues that we are. Where
So there might conceivably be a strike at all 5 simultaneously?
Yes. We originally started prior to the strike notice on January 2nd, 12 hospitals. But we've had good moves in Brooklyn, with the safety net hospitals, Brooklyn and Staten Island. They have active tentative agreements or have completely settled. But they signed off on, which is a good thing, they signed off on health and benefits pension, no matter the cost. The hospital agreed that whatever it is, they will pay for it, which NYP has yet to agree to. They actually refused to do so, even though they're the top running hospital in Manhattan. They're holding our healthcare and benefits hostage. Like Sophie said, the table is not good. We are in a crisis. Patients are suffering now. That's the thing. People like to say that they're going to suffer during the strike. They're suffering currently with us there because we are stretched so thin. We've been signaling to management for months. We cannot withstand the burden any longer. So we're here. We just thank you for having us. We want to update the community and we implore the community to support those who care for them at the bedside. We have these flyers that the union has generated to have community members do different things to show support. They can donate to the Knives on Strike Hardship Fund. They can pledge their support and sign a petition. They can send a message it's like an automated email sent to the CEOs. They can join us at the picket line. Well,
we're hoping there is no picket line.
Right, we're hoping, but we have to be ready. Like Julio said, preparing for the worst,
Right.
hoping for the best.
Did you bring copies for all of us?
I have a bunch.
Okay,
yes.
good, okay.
And I think currently we didn't even meet with management today across the table. We are currently located at the Armory. We're negotiating at the Armory. It's very close to the hospitals, so that nurses come and actively participating, actively fighting for the contracts that have to do with their livelihoods. Management doesn't like that.
You're not negotiating while running around the track, I hope.
No, the other kids are running around the track though.
No, but I think they feel like that.
Yeah, maybe, right.
We're running in circles and no one's helping.
So there are rooms downstairs that you can use.
Yes, so management is in a separate room. We are in another room.
But-
We have the mediator, as Julio had said.
There is active mediation.
There's an active mediation. I wouldn't say it is
Management is
entirely moving
responding
the
to that.
table, yeah. We have presented a whole list of tentative agreement proposals, and management states that they will not be able to move anything without the health and benefits cost, which, as we said earlier, that the other hospitals have already agreed to whatever the cost is, we're gonna pay for it.
Really?
Yet NYP has not agreed to that. They're not willing to. I'm sure they have another angle,
Okay.
but
Because I thought I read that Mount Sinai was also saying that they could not agree to the wages and
the
benefits.
same.
Yeah, but all the safety net hospitals, all of their management has signed off.
I'm.
Safety nets, yeah. Sinai Maine, Sinai West, Montefiore, Bronx Care, and NYP Columbia have not settled. And they're
But
currently-
the others that you referred to as safety net hospitals,
Brooklyn
they-
and Rumsey and Staten Island.
they have agreed.
They have
agreed. Yeah, you see, I believe that this hospital, to some extent, also is a safety net hospital. I mean, I don't know. I mean, because it covers so many Medicaid eligible and other patients, other people who have really in this community nowhere else to go. So for us, I consider it to be a safety net hospital. Maybe
I think by breakdown.
I mean, obviously, it's also it's very well off.
Big
And
system, yeah.
it has a lot of money, and generates a lot of revenue. But for us and for most of our residents, we look upon it, I think, as being our safety net.
Oh, 100%.
Yeah,
I mean, we get sick, that's where we go.
right. Yeah. Yeah, I just want to be clear, like, we want a contract. We don't want to strike.
You know,
But if we're out on strike, it's because NRP forced us there.
all right, well, we certainly join you on that idea. No, I think nobody wants to have a strike.
Yeah. And we just want to say we're proud nurses. We love caring for the people of our community. We just want to take care of the people in our community safely.
Well, and we want you to continue to do that.
So thank you guys for having
Because we recognize the very important role that you've played, not just during COVID, but all the time.
Thank you. Thank you so much.
Right. All right, and you'll continue with Sophie. You can't stop the streak now. Well, you.
Admitted. Where should I send my notes?
You have.
Thank you for inviting us.
Who is that?
Right.
Oh, that.
Manny de los Santos is Chief of Staff
Right.
Diana Pichardo.
All right. But do you have anything you want to say about that legislation that we spoke about early on in the meeting?
No, sir. And it's been a while and it's been a pretty long meeting. So can
Okay.
you please remind me to see
Well,
if there's anything that I can share?
Yeah, well, we passed a resolution which we're gonna send to the assembly member in support of the legislation that he's already co-sponsoring to reduce plastic waste and packaging. So
Oh, no. If he's co-sponsoring and
Right.
I mean it's a no-brainer. I think we
yeah,
need
right,
we
yeah.
need some
So
safer regimens.
Right, so we just want him to increase his efforts to try to get the legislation on the state assembly agenda and to try to get it passed.
Yes, that is the work of all the legislators at this time, and that is exactly what we should do
Right.
as constituents is make sure that this is also a priority
Right, well,
in this
Manny is the one
legislative
we have to,
session.
Manny is the one we have to count on. All right, well, thank you so
You
much
got
for
him,
coming.
you got him. We're here.
Very good.
Thank you so
hope-
much.
Okay, hopefully you will continue to come to our meetings. Thank you.
Yes, thank you.
Okay, we're on to old business. I sent around to the committee members the latest report from DEP on the top 30 complaints generated from people in Board 12 in the month of December. The top complaint was dirty water, 34 such complaints. And I forwarded that to our the DEP Borough Commissioner to point out that we're still getting these dirty water complaints. You remember he came to our committee meeting in November to talk about what was causing them, and I had hoped that maybe by now the issue would have been resolved. And then the next three categories of complaints, the highest number of complaints all relate to noise, construction before and after hours, barking dogs, and alarms. Is there any other old business? No, very good. Under new business, I forwarded to everybody a proposal that we'd received from the Latina Health Project. I don't know, considering the hour, I think I'm gonna put this off till the February meeting. But it seemed to me as though if people took a look at that proposal, it's an opportunity for us to maybe work with an organization that's doing some interesting and important work and try to extend the outreach of this board into the community, especially serving Latinas who may need advice and guidance on health and fitness issues. And I'd like to take this group, this woman's offer, accept her offer and try to work with her and maybe link up with another CBO, the Northern Manhattan Improvement Corporation, maybe, or the Dominican Women's Development Center. Let's see if we can make this thing happen. And I think this would be a good, the other reason I want to put it off until February is because I think this is a good a project that our new district manager could work on. And this would feed into her expertise about doing community outreach and reaching people in our community that are currently not really being reached by this board. So I think that would be I'm talking about the proposal that we received from the Latina Health Project. So I'd like to go into a fuller discussion about it at our February meeting. In terms of new business, we have a gentleman here who wants to speak to us, Mark Franklin.
Yes.
This is your chance.
Okay, I'll try to keep it as succinct as possible, given the time as you mentioned. So from 169th Street to 172nd Street, I say that there's dioxin in the air, and that is the burning of plastic. It's been going on for a couple of years now. I started to notice it more often, happening more frequently, because I've been home for the last 3 months with my newborn. Usually they do it in the morning time or wherever when I'm not home, so I haven't really noticed it.
I mean, so who is doing this?
There's a particular building that's emanating smoke that's on 171st Street in Audubon that I walked past that I've seen and I.
Like a residential or commercial?
Residential,
Okay.
or I think it's a small business. They're both connected. There's.
Okay, it's a
Right,
mix.
Do
right.
do you have the exact address?
No, because I haven't honed in on exactly which building it is, but it's in one of those corner buildings on 171st Street in Audubon. Over the course of 2-3 years, I've contacted 311 about suspicious sweet chemical-like smells, which is not very common. But it's New York, you know, so you figure, oh, maybe there's some construction going on. Maybe there's something going on outside, you know, maybe there's a strange person burning something. But this time around, my partner actually, she identified it through her national citizenship of Japan. When she was in high school, it wasn't illegal 15 years ago. They would just burn all the plastics inside of the schoolyard. And the smell of dioxin is very familiar to her, and she's identified it happening more and more frequently these days as we have been home daily taking care of a newborn. Our pediatrics has reached out himself. We called 311, the case has been closed. They get back to you in 24 hours, and she's probably doing like 4 times a week, and it's just ongoing closing cases. So that's all I really just wanted to bring to you and everyone's attention today.
Are there particular days and times when you find this happening, or?
It's more frequent now, actually, Jacob. So before it was relatively around 8 to 9 p.m. And maybe around 5 to 6. Nowadays, it's probably 4 or 5 times a day. And we've invested in a very state-of-the-art air purifier for the purpose, but you know, we cook and we open up the windows when we cook. Staying at home all the time, I mean, like you really.
I mean, nobody should be burning garbage at all.
Yeah, that's
It-
a concern.
Right.
I mean, regardless of whether it's plastics or something else, nobody in New York City is, I don't know, 30 or more years is supposed to be burning any garbage.
Right.
Yeah.
Right. And it's not in any other location. I mean, we went out for walks.
Is there any way you could identify the exact building?
So I had it on my Google Maps and I found the building. I think it was the 580 to 530. Ironically enough, this building is also 530, but from that 171st Street Audubon corner to 172nd Street Audubon corner, it's emanating from one of those buildings consistently daily now. Both of them are projecting smoke. You can't really tell which one's doing what. However, the smell is very distinguishable. It's a sweet chemical smell. It's not sweet like pastry, but sweet like it's not supposed to be inhaled for sure. And then, you know, she identified it as dioxin, which.
So it's Audubon Avenue between 171 and 172?
Yes. Yes, and we call 311.
It would be on the east side of Audubon, west side?
The west side of Audubon, yes.
Yeah, there's several businesses like on this stretch. There's a laundromat, restaurants.
Right.
Yeah, but it's coming from like an incinerator in the building.
Right.
Yeah, let's see.
Yes.
All right, well, we'll see if we can get an inspector there.
So 311 has been, that will help that. I mean, the representatives are very cordial, very nice. They have follow through with their reports, but there has been no
Right.
results.
Did you sign in with your contact information? Do we have it?
No.
Or did? Julio?
Yeah, I was gonna just add, I mean, if call 311 and you have the complaint numbers, I think it would be helpful if you should have it.
I do have the complaint numbers actually, because they do send you a text message.
Yeah.
Following up with you if the case has been closed or it's ongoing.
Yeah, that's helpful for the district service cabinet.
Yeah,
Um,
well, except, I don't know that DEP comes to the, does the
Yeah, they
DEP,
do.
DEP comes to district service cabinet?
Yeah.
Really? Oh. Maggie?
I was gonna augment that because over many years, I have smelled, you know, being an environmental scientist, I also am familiar. I was thinking it might be perchloroethylene, which you get from dry cleaning services, but you know, anyway, I have complained many times and, you know, it doesn't do anything, you know, it's a defunct kind of system, it's.
No, but that's a good point. Could be the dry cleaner.
so on Google Maps, it says this dry cleaner is temporarily closed, which is like,
The
Then
business
that-
of that too, but they're functioning daily.
okay. Cause I was like, if it's then closed, then that is like possibly a hazard, you know what I mean? But if it is actually operating and it's just, you know,
Right.
whatever, but
Can you see an address for the dry cleaner?
yes, it's 134 Audubon.
But it brings up the issue about DEP and their response.
Yeah.
Which is
Right.
not, you know, something needs to change because, you know, we're just the tip of the iceberg here.
I think also, you know, I'm not sure if you've engaged like the state, right? So the State Department of Environmental Conservation, might be another avenue.
Yeah.
Okay, all right. So, like,
We're
To
very
go-
concerned.
to go-
you know.
Right.
Yeah, well, I don't know.
It does sound
Sometimes-
like a good thing to get our new district manager on.
Yeah,
Absolutely.
yeah.
Yeah.
Follow up on that.
Yeah.
Maybe get an inspector out, or she could
Exactly.
definitely raise it to
Actually-
district service.
Yeah.
cabinet.
Well, I'll reach out to, this is the kind of issue that a district manager should definitely be working on. But, in the absence of that, I'll reach out to our contact at DEP.
Very much appreciated. Thank you.
And, do I have now your, email and phone number?
Absolutely.
Okay, great. Okay, all right, any other new business?
I
Yes.
have an announcement.
I'm not up to announcements. When I call announcements, you can speak. Maggie,
Waste management plan?
say something.
Okay. I'm Maggie Clark, I'm with the Manhattan Solid Waste Advisory Board, head of the Long Range Planning Committee. And the city, after 20 years, has put out another draft solid waste management plan. And it's bad. It's worse than the last one, which was an export plan. So for the last 20+ years, we have been exporting half of our recyclables and more than 90% of our organics. And all of our reusable materials that get put on the curb and not repaired to be burned and buried in landfills and incinerators, most of them out of state or upstate. And they're planning to do it again. They've issued a plan with a short turnaround, January 16th, but the date doesn't.
When was the plan issued?
This fall. And, you know, we've been asking for extensions and so forth. The Long Range Planning Committee has lots of materials that we have been writing about this, and I want to come back tomorrow, next month to ask for your approval of you know, a resolution that
Okay, but you'll get us all the information for the next meeting. You'll get us the details about the solid waste management plan.
Yeah.
Is it available on the
Yeah,
sanitation website?
it should be.
Okay.
And so they basically have two alternatives. One is to continue everything that they are doing, which is horrible for the environment, horrible for, well, everything involved. And then the other one is they're weekly suggesting, okay, well, we can go from 18% diversion from landfill and incinerators, which is all due to recycling, to change that to 30.5% over a 10-year period. The thing about it is we're only spending less than $1 per person per year on education. of recycling education, composting education. And the recycling partnership says that the state of the art, the best practice is $10. We've been lowballing this for decades. And then, because sanitation is really not interested in this. They like to pick up the garbage and put down the garbage. They're not interested in finding out why are some people participating and not others, and so forth. And we're expert in this. We've been looking at nothing but this for years. So we're preparing our comments as we speak. And
all right, but if there's any material you can send us in advance, so that we can be fairly well informed,
sure,
that would be helpful. Natalie, why are you still here?
Well, it's interesting and why not?
Okay. Now.
Don't you gotta look? Yeah, well, I live near.
Like her, bring her back.
I live nearby. Don't you have to go all the way back to Brooklyn?
I got a book.
Okay, all right. Okay. Announcements. OC, you have an announcement.
Yeah, so the ASPCA gave us more dates for this month. So we have more spay neuter clinics, potentially also wellness vaccination clinics, but I'm not really sure. I have to check with them. So the dates for spay neuter for January are wait a minute. Sorry,
Did they do?
Okay.
Did they do flyers that we can circulate?
Well, I will find the flyers. I'll get the flyers in English and Spanish. So the dates for this month are January 7th, which was yesterday, the 8th today, the 12th, 16th, 23rd, 26th, and 29th. This is for our 4 zip codes, 32, 33, 34, and 40. So we should, encourage people to bombard them and request for appointments if they have, pet owners that, eligible, like what they call eligible for as low-income pet owners. So people should call them.
All right, we got to get the word out. So
I just want to say that our office could support with that outreach. We've had pretty cool pieces of legislation this year for pet owners. So that would be a good, great capacity building.
What legislation do you have? Can you share?
Yeah, the pet sick leave. We're actually looking for an advocate to help us spread the word. It's if someone has a sick pet, the legislation is allowing you to take time off, paid time off, to take care of your sick or dying pet.
That's very nice.
I never heard of that. Wow.
Well,
Yeah, it's a first. We're gonna champion it, but we need some help.
Okay.
You have to keep us informed of the of this type of legislation that you proposed, so we can help support some of them.
Let's get in an email chain, and let's probably have a offline meeting.
May I suggest you should also look into putting pets as dependents, because on the IRS. No. There is a proposal in one state. I forget which one is it. Because they can't feed themselves. All of that. You have to take them to vet and all of that.
We're actually looking at that.
Okay.
But we have some jurisdiction issues. It's more federal, but we're looking to see if there's maybe a tax credit or something that we could support with. So we're actually looking at that at this very minute.
Okay. Well, I think we need to talk then, because I have some other ideas.
Okay, very good.
Okay.
Okay, any other announcements? Heidi, you have an announcement. Didn't you raise your hand earlier?
No, I didn't. I know I did not.
You sure you have nothing?
My last health and environment meeting.
Well, no, that's not an announcement. No, that's not acceptable. That is absolutely,
Because she's been elected to the executive.
So what? Does that mean chance to lead this committee? Where's her loyalty? No, this,
I was
Okay,
assistant secretary and did like two and plus two committees with that. Come on,
oh,
stay.
yeah, there's no problem with that.
Okay,
Yeah,
we're not all you.
yeah, okay, we accept your withdrawal of that item. Okay, anything else? No? Okay, our next meeting is February the 5th. We're gonna be getting a presentation from the Ryan Health Network. We haven't heard from them in a long time since they opened up their Washington Heights office at on Wadsworth Avenue near 181st Street. And we're gonna hear from a woman named Maggie Clark about the solid waste management plan. And hopefully we're gonna hear that there was a successful outcome to the negotiations between NICEA and the hospital. All right, we're adjourning this meeting at 9:25 PM. Thank you all for coming. Natalie, go home.
Thank you. Have a good night.
Thank you, everyone. Should I leave this by the door? Actually, thank you. Need that. Thank you very much. Thanks for coming and letting us know. We'll figure it out. Please, yes.
See you again.
You'll see me again.
1 second, it's Mark Franklin, what is this? Oh, NYC
NYC
at Gmail. Okay, very good. Okay.
Yes.
Okay. And we even passed a resolution. So.
Yeah.
Honestly, I feel like we got out kind of early considering.
Hey, all.
Hi.
Hey.
Yeah.
It's always.
I love this
it's always
outfit.
good around here.
I love this outfit. You look great.
Oh, you
I'm kind of like in the same color scheme. All red and black going on over here.
I meant to come peek in here, I see in there, but it was a lot going on.
We've had a lot going on.
It was a lot going on for the first of the year.
Yeah.
I've had a week contemplating, but between this and like the crazy thing at work.
Yeah.
It's been a week, like, it's been, the world, everything, it's just been like a horrible.
That's you, that's you.
I was out here killing people, there's that. They shot 2 more people on Twitter.
Like Germany's listening or something. Yeah, I just.
I gave it.
Like
We're living in the modern Gestapo.
Is there a bathroom?
Yeah, there is 3 of them.
This way?
Yeah, make a right turn.
Okay.
The doors should be open. Right before you get to the border.